today. So today I would like to welcome Dr. Kylie Meyer. Dr. Kylie Meyer is a postdoctoral researcher and faculty at UT Health San Antonio School of Nursing. She's trained in gerontology. Her research has a focus on social connectedness among family caregivers and online interventions to support diverse needs of caregivers. She's focused on improving the quality of life for persons with progressive neurological conditions and their family caregivers. We're glad to have you today, Dr. Meyer. I'd also like to introduce another wonderful colleague of ours who is an amazing partner with the Caring for the Caregiver program. Melissa Flores is a licensed professional counselor at UT Health San Antonio Glenn Biggs Institute. She provides counseling, therapy for individuals and families with the diagnosis of dementia, and serves as the community coordinator of the Biggs, partnering with local organizations to create and provide socially engaging programs for our community. All right, that is the end of my slides for now, so I will turn it over to y'all to begin to share. Thank you so much.
Great, I'll start sharing the screen. It's glad to be here with everyone today. I'll let Kylie start with our slides first here though.
And thank you so much, Melissa, for taking on the slide sharing. I really appreciate it. Everybody else should be grateful too that I'm not the one trying to figure out the technology, I swear. Well, thank you so much for coming to talk today about the importance of sleep. I'm sure many of you have stories and probably could tell us a lot about the importance of sleep. And we want to, once we finish our presentation, kind of and make sure everybody's on the same page as we talk about this topic. Hear your questions. And I have to say, one of the nice things about being at Caring for the Caregiver is not only do we provide caregiver education, but we're also doing research. And so that means that, you know, a lot of the ideas and the questions that you share with us during your presentation or during these sessions might actually end up back in our research as investigations where we say, we really need to do more on that, or we need to learn more about that. So please share your questions, comments, concerns, and experiences. All right, next slide. So today, just to kind of give you a breakdown of where we're headed, is first we want to talk about the importance of sleep for all aspects of our health. And even as I was preparing for this presentation, I think I started being much more intentional about going to bed earlier, realizing all these consequences that not having enough sleep can have. And then the next point, probably you again could tell me more about, but I wanted to talk about how family caregiving can affect sleep quality. Next, the real expert, Melissa Flores, is going to be talking about sleep habits for family caregivers and people who are living with dementia, and then what to do if you are experiencing sleep problems or your loved one is experiencing sleep problems. And I want to give a quick brag too. So Melissa Flores does have some special training. Actually, not only is she a licensed clinical counselor, but she also has, okay, let me make sure I get this right, cognitive behavioral therapy training in insomnia, right? Which is this fantastic resource to have in our community. So I'm hoping to learn a lot from her slides as well. And next slide. And I already see some questions, so we'll come back to these and we'll save those. Before we really dive into kind of the consequences of
look at this.
Sleep, let's go into what is sleep exactly. And because there are much smarter people who could explain this topic with much better graphics, we're going to play a quick video about this.
Every night, almost everyone on the planet enters into a state of unconsciousness and paralysis. But what is really happening inside the body when we drift off? And what's the impact if we don't get enough sleep? Sleep is regulated by your circadian rhythm, or body clock, located in the brain. The body clock responds to light cues, ramping up production of the hormone melatonin at night and switching it off when it senses light. There are 4 stages of sleep that the body experiences and cycles throughout the night. On a good night, we cycle through these stages 4 or 5 times. Stages 1 and 2 are light sleep, This is the transition from being awake to falling asleep. Heart rate and breathing begin to slow, body temperature falls, and muscles may twitch. Stage 3 is sometimes referred to as delta sleep because of the slow delta brainwaves that are released during this stage. This is the first stage of deep sleep, where our cells produce the most growth hormone to service bones and muscles, allowing the body to repair itself. Stage 4 is where we begin to dream. The body creates chemicals that render it temporarily paralyzed, so that we do not act out our dreams. In this stage, the brain is extremely active, and our eyes, although closed, dart back and forth as if we were awake. Humans roughly spend 1/3 of their lives asleep. Modern lifestyles, stress, and the proliferation of technology mean that people are sleeping far less today than they were a century ago. Sleeping less than 7 hours per day is associated with an increased risk of developing chronic conditions, which could reduce life expectancy. So for a healthier, longer life, get some shut-eye.
So just, I want to kind of look at that. I don't know how you felt about that video, but for me, I think what struck me was, well, one, they have beautiful graphics and that's all great. It's really uninformative though, isn't it? Here we are characterizing, this is what happens, this is what happens. But boy, I don't come away with why. And I think that's something that's interesting about sleep is a lot of our research characterizes what our body does, and we can describe what it looks like, and yet we still have a lot of mystery around what does actually sleep do for us? Why did we evolve this way to need sleep? What is the purpose of dreaming? So I think it's fascinating to me that what we can tell is we know it's critically important, and yet there's still a lot of mystery about it. Next slide. So I want to go into a little bit more about how sleep really affects every tissue in our body. And sometimes we talk about in nursing, and I know many other fields, the biopsychosocial model. I think I would also add in here cognition. So we should have the bio-cogo-social psycho model, but that doesn't roll off the tongue. So we'll call it biopsychosocial for now. But I want to kind of give some examples about these different areas where sleep can affect our health over time, and actually even immediately. So we have these long-term consequences of not getting enough sleep, but also shorter day-to-day consequences. Next slide. This is just a really interesting study that was done fairly recently, so 2015. So I guess maybe not so recently, but hey, where did the last 2 years go? But I think especially during the pandemic, when we think about the implications of poor sleep on our immune system, what these researchers found is that people who get only about 6 hours or less of sleep actually are at about 4 times increased risk of catching a cold. Now, I'm not aware of research that's been replicated whether this research has been replicated with COVID-19, but I think this is probably pretty compelling to, hey, in addition to wearing your mask, using your antibacterial, especially nowadays as we're going into flu season, as we're worried about the pandemic, it might be a good precaution to try to get an extra hour of sleep to boost your immune system. Next slide. And please, 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 I promise I won't test anybody about what this ugly graphic means, but I wanted to walk you through what this is showing because it's actually pretty compelling once we break it down. So this is a figure from what's called a meta-analysis. And when researchers have a lot of papers that are done on a given topic, but they want to really summarize what the state of the research is, kind of put it all in a nutshell, we'll sometimes do what are called a meta-analysis study, where we take all the results from all these different studies, we combine them to figure out, is there really a relationship between this variable and this variable? So in this case, the researchers were looking at the relationship between poor subjective quality of sleep. So this is what's your own self, so an individual, how you would rate your sleep quality, and the relationship with systolic blood pressure. Actually, I put diastolic as well, so that systolic is that top number you see in the doctor's office, diastolic is that bottom number. This figure is concerning systolic, but the findings were very, very similar for diastolic blood pressure, which we want to keep, below 120 if we can. In this case, we see this line going through. It says on the far right side, mean difference IV, random, blah, blah, blah. But you see these kind of weird diamond things going back and forth across the line. What this figure is showing is that because a lot of these diamonds are on the right side of the line, that's showing us that the data seems to show that there is a relationship between poor subjective sleep quality and having higher systolic blood pressure. So I think that's interesting, the cardiovascular risks that we see with poor quality sleep, and that's shown across studies. Next slide. And this one I think is pretty intuitive if you've ever woken up feeling like you're a little bit grumpy because you didn't get enough sleep at night, maybe jet lag, you woke up on the wrong side of the bed, excuse me. And we know that sleep will affect our emotional health. What we see here is kind of this cyclical pattern that can occur where, you might get not so good sleep the night before, and then you feel tired the next day. Then, because of your tiredness, you don't have quite the equipment you need to deal with some of the stressors that you encounter during your day-to-day life. So maybe, you mispronounce a word during your presentation. How embarrassing. And then suddenly you have this low self-esteem. Don't worry about me, guys, I'll be fine. And then you go to bed at night and you're feeling worried and stressed. And because of that worry and stress, you're not able to fall asleep as quickly as you would like to, and maybe have poorer quality sleep. Now, over time, this can be cyclical. You can kind of see, okay, lack of sleep leads to this difficulty coping, worse self-esteem, more worry, and it goes on and on. Well, certainly eventually your body does sometimes, if you've ever had that experience of falling asleep in front of Netflix and waking up going, oh my gosh, what time is it? Your body might eventually take over to break this cycle, but it is something that we want to try to prevent by doing things like getting better quality sleep. Next slide. And so these are just a couple of points that I found really interesting that came out of review quality in terms of the impact of poor sleep quality on our emotions. So a person who is sleep deprived is less able to regulate your emotions. So you might encounter something that you find aggravating, or somebody you just find really annoying. And typically you have the wherewithal to go, I'm just going to keep my mouth shut. I'm going to behave myself, whatever it might be. In this case, you might slip out and say what you don't really want to say to this person. You're less able to regulate your emotions and behaviors when you're sleep deprived. You might also see things more negatively. So if you wake up and you're on the way to work and you encounter traffic, maybe nobody likes traffic, but this morning, man, you didn't get enough sleep. It feels like everybody is driving terribly and you're just mad at everybody, right? I don't know if anybody's had those kinds of mornings. You might have more intensified negative emotions. And this is kind of, a couple things will feed into this. One of the things we find when somebody is sleep deprived is that they can't ignore things that are negative. So, sometimes when we have something kind of challenging in our life that's upsetting to us, we can kind of put things in perspective and go, all right, all in all, this isn't something that I need to be worried about or that angry about or all these other things. But somebody who's sleep deprived is less able to push it out of mind and focus on the positive and get that perspective back. Kind of on the flip side of all of this is that when you are sleep deprived, you have actually kind of this reduced ability to kind of recognize positive emotions. So something that might normally make you very, very happy might not be as effective of a positive stimuli anymore. And then we know too that people who are sleep deprived have more experiences of depression and anxiety, as well as feelings of loneliness. This last point, I think, is, and there's not quite as much research here, but there was a really interesting study done a few years ago, talks about this effect where people who are more sleep deprived are more likely to blame others. And I just want to take a second to pause and focus on that point, especially in the context of caregiving. All right, so what we know with caregivers is, especially when you're caring for somebody who's living with dementia, is you might start to notice these behavioral symptoms start to occur over time. So you might see things like wandering, or a person who might lash out or say things that are inappropriate or embarrassing in public. Well, if you're a new caregiver and maybe you don't necessarily recognize these behaviors as being signs of the disease yet, you might blame this person who's living with dementia for these kinds of behaviors. Why can't you act this way? That kind of thing. I don't know if anybody's had that experience as well, but we're more likely to see this blame occur when you're sleep deprived. And when we go and talk about kind of the effects of caregiving on sleep, we start to go, this could raise some issues. And actually, next slide. We've actually done some very, very recently, hasn't been published yet, hot off the press, or not even on the press yet. But what we did recently was we asked family caregivers to complete 14 days of daily surveys. And I think a few people on here actually participated in the study, so feel free to add more comments or what your experiences was here, or if this matches up with what you thought you experienced. And so each night the caregiver would receive a survey that they would complete. And within that survey, they would rate the quality of their sleep the night before. So on a scale from 1, not very good sleep, to 5, so very good sleep. And then we would ask them about the quality of care that they think they provided to their loved one living with dementia. And these included things like for very good quality care or excellent care, things like listening to your care recipient's wishes and opinions. In contrast, elements of poor quality care were things like saying something you regretted to the care recipient. And what we found was for each additional point of sleep, so each if you consider your sleep to be better, you had a lower odds of engaging in low quality care. So saying something you regret to your loved one, unfairly blaming them. And so this is an interesting relationship that I think we want to pay more attention to, because we know family members want to provide very good quality care in the vast majority of cases. So to help you to do so, it's important that we encourage high sleep quality. This is one of the reasons why we're holding this presentation today. And I think corresponds with that kind of adage I think a lot of people have heard in the past: you have to refill your cup, or you have to put your own mask on first. And I think this is a way to empirically demonstrate that the importance of that adage. Next slide. All right, so lastly, we'll go a little bit more into how sleep affects our cognitive health. And there was a study done in 2020 that was published in JAMA. And what they did is they took some survey data that was collected in England and collected in China, and they combined it. So they had a really giant sample. And they looked at individuals who had extremely short number of hours of sleep, so less than 4 hours a night, and people who had very long sleep, so more than 10 hours a night. And they compared these individuals to people who had, the average number of sleep hours, about 7 hours. And what they found is that people with extremely long or extremely short sleep hours actually had faster rates of global cognitive decline. And I know that's kind of a funny way to say this. So it wasn't just that these individuals who slept too short or too long of a time had poorer cognition, and they did see that. It's that the trajectory of decline was that much faster in these individuals. And I know that can be a little bit scary to think about, but I do want to emphasize when we do research like this, we're talking about the average person. There were certainly people who had, very short hours of sleep and very long hours of sleep who were the exception, who maybe didn't have any cognitive decline. But if you look on average, we did see this relationship or this trend. When they started to break down into different kinds of cognition, what they found is what was really, really affected, not only the global overall cognition, was orientation. So that part of our cognitive functioning that tells us what day it is, what year it is, who the president is, that seemed to be particularly effective for people with very short sleep hours. Next slide. And this is just an illustration of that effect, where we see this kind of upside down U shape, where we look you look at kind of that horizontal axis at the bottom, that sleep duration, and then on that vertical axis, the y-axis, we see the cognitive score here. We see that people who are at that point of about 7 hours of sleep per night, they're doing, probably better than most people, especially those with less than 4 or more than 10 hours on cognition. Next slide. And then again, I feel silly talking about this since you all know way more than I do from personal experience, I'm sure. But just a quick review on how caregiving affects sleep. So we know that caregivers can sometimes feel stressed or worried or overwhelmed in this role, which could prevent a person from having high quality sleep, such as keeping you up at night, where you can't count sleep, you count the sheep. It's not very effective because those worries keep, busting in and breaking your train of thought or your ability to rest. We also know that caregivers do experience some health issues or are more likely to experience certain health issues that can disrupt their sleep. So we know that caregivers to people who are living with dementia in particular have about a 1 in 5 chance of experiencing depression. According to one study, of course, there's some variation in terms of what research has reported, but we know that depression can have signs of insomnia. Now, just as a comparison, in the general population, proportion of people who have depression is about 1 in 10. So we do tend to see higher levels of depression, which can affect sleep quality within caregivers. So that kind of indirect effect. And then lastly, you probably recognize this. So care recipients might experience nighttime wakings that can disrupt a caregiver's sleep. And that can be due to a couple different reasons. So I think there was a question in the chat where Kathleen asked, is it typical to sleep more as the disease progresses? Is this emblematic of being in the end stages of the disease? And it is actually. So we do know that sleeping more is a characteristic of somebody with later stages. But really, sleep can be affected throughout the entire trajectory of the illness, where somebody's sleep patterns will be changing for a multitude of reasons. One of those is the circadian rhythm, which is affected by our perception of light. So, we feel more awake during the day, we want to sleep at night. That distinction isn't quite as clear in the mind of a person who's living with dementia. And then the mind's ability, we saw in the video, your brain is doing so much to kind of trigger that sleep effect. As dementia starts to affect different neurons in the brain, it can affect the ability for example, for the brain to release the chemicals that it needs to start to induce sleep, which can have that effect in later stages of causing somebody to sleep more, for example. But it might also, we also know that nighttime awakening occurs for a variety of reasons. It could be that somebody needs assistance to get up to go to the bathroom because of mobility challenges, or just to get that glass of water. So just a lot of reasons we do see nighttime awakening. Next slide. And then I swear I'm wrapping up here, but just to kind of give you a sense of how prevalent these interruptions are for family caregivers, we do see on this top bar chart where you see those blue horizontal bars, this is portraying the occurrence of nocturnal wandering among people who are living with dementia. So we see about 15% of caregivers report that the person they're caring for experience nighttime awakenings about once or less than once per month. In total, though, we see about 1/3 of caregivers are experiencing nighttime, or of people living with dementia are experiencing nighttime awakening. And then in the figure below, this is from what's called a systematic review, another one of those kind of big summary studies that researchers do to kind of pull together all the evidence that we have. We see in this study from McCurry and Terry from 1995 that up to 2/3 of family caregivers themselves experiences sleep disturbance. So if this is an issue for you right now, you are certainly not alone. Next slide. All right, this is my very last one. I don't know about you, but during the start of the pandemic, I felt like I wasn't sleeping very much. And, I was up looking at my phone, looking at CNN, looking for updates. I think a lot of us were in those shoes, and here's the empirical evidence to prove it. So this is a study that was done very early in the pandemic. And what they found was that when they compared people before that lockdown period, so March and April and May of 2020, and then after, we saw a change, kind of the shift in when we were sleeping. So we went to bed later and we woke up earlier. And that was possibly due to the anxiety we were feeling, our disrupted routines in terms of staying home from work. We're still finding out what long-term effects are. So if people are still having these experiences, but if you did have that night, doom scrolling late at night on your phone while you were lying in bed, I think a lot of us were doing that. All right, so I'm going to hand it over to Melissa now, who's going to help us get out of all of this, these negative consequences of getting bad sleep, and tell us what to do.
Thank you so much, Kylie. Yes, so now we talk a little bit about why sleep is so important, what it's doing in the body, and how do we figure out how to problem solve around maybe where some of our sleep challenges are. But I first wanted to kind of open it up to the group, and you can feel free to chat in the messages or unmute yourself. But I wanted to get a sense of what everybody believed was the right amount of sleep. And then more than that, what makes good quality sleep? So, kind of looking to see what are some general ideas about what good sleep is. So how much sleep do you all believe that we need? If anyone wants to jump in. So go ahead, Kathleen.
Well, I usually sleep 8 hours. I try to go to bed at 10 and get up at 6, but I found concentrating on all those little lights. We have so many little lights. Everything's got a red light, a blue light, a green light, all these lights. I've concentrated on trying to get those out of the bedroom, and I think that really helps a lot to have a dark sleeping environment.
Exactly. And so, yeah, thanks. You said 8 hours, and I love Sarah's answer, more than I'm getting, which is probably for a lot of us. Someone said 7 hours, others 8 to 9, 7 to 8. I appreciate the range because I think what we're used to hearing is 8 hours. Everybody should get 8 hours of sleep. But as you saw with Kylie's graph, there really can be quite, some differences between people, between what's actually good sleep for somebody. I think that the graph that Kylie showed shows us that getting too much sleep or too little sleep can be bad for certain situations. And that's what's unique about sleep, is there is no right number. There's no magic number for sleep. It's really going to be dependent on the person. So some people may actually need as little as 7 hours, and that's what they function well on. And others may need close to 10 hours. But if you're getting not the right sleep for your specific window, that's maybe when we start to run into some problems. And so healthy sleep is really quantified by being able to fall asleep quickly. There's kind of a magic window here that if you fall asleep too quickly, that can be a sign of a problem. But if you're taking too long to fall asleep, that might start to be where your sleep is having some trouble. Staying asleep until your desired wake time. So this means not waking up in the middle of the night or not waking up before your alarm. That's going to really mean that you're having good quality and healthy sleep. But the most important point of all of this is feeling overall rested and good about your sleep. Sleep is a problem when it feels like a problem for you. And so whether you're getting 7 hours or 10 hours, but you feel good about your sleep, that's what's going to be most important. So some common myths, like we talked about, it's not always a specific amount of time. And the other common myth is that it's not something that you need less of as you get older. That's a really common thought. We know babies need a lot of sleep, but as adults or, as we get older, we think we don't need as much. What does change over time is the pattern. So we might go to sleep earlier and not be able to stay up as long due to those circadian rhythm changes, but the actual amount of time that you need to sleep is not going to vary significantly from, say, teenage years to adulthood here. So that's where, it could be important to say, yes, I'm older, I know I have more responsibilities, but I still need the same amount of sleep as I was getting. So unhealthy sleep, there we go, is the opposite of what we talked about. So having significant difficulty falling asleep, and this means greater than 30 minutes. If you're having more trouble falling asleep, or you're really just sitting in bed for longer than 30 minutes, ideally it's about 15 minutes, then that might be a sign that you're having trouble with sleep. Having frequent wake-ups throughout the evening and or for long periods of time. So this can mean, you have one wake-up for a very long period of time and you aren't able to go back to sleep, or you also find yourself waking up, 6, 7 times a night, even if it is just for a few minutes. We want to make sure that sleep can be as undisrupted as possible. And then, like we mentioned in the last one, if you're feeling the negative impact of your sleep, if you're feeling tired and sleepy during the day, that can mean that we're not getting the best quality sleep that we'd like. Again, there's always an asterisk with sleep, that sleep can be interrupted due to different life events or certain changes that are happening. But what is important about sleep is that it can get back to what it was beforehand. When we have maybe a life event or a major change that changes sleep and keeps it there, even though the life event has restored or things have gone back to normal, that's when we maybe start to see some problems like insomnia or sleep difficulty, when the thing that disrupted sleep has gone away, but the sleep still is a problem. that's where we maybe are starting to see some challenges. So these next things that I want to share with all of you are habits. So these are sleep habits, sleep tips, if you will. This is where we kind of hear the word sleep hygiene. I'm sure a lot of you are familiar with that. That are important things to follow, but they don't always make or break sleep. So doing these things may not always fix sleep if we're having other issues, or if we don't do these things, it's not going to necessarily ruin your sleep, but they are good habits to follow. Like I like to think of, brushing your teeth. These are good habits to get into. And so the first one, which I think is one of the most important ones, is sleeping only as much as you need to feel refreshed the following day. We sometimes think that, we can build up sleep, or we can kind of store sleep. We know we're going to get disrupted sleep in a few days. So we try and sleep in a little bit and say, I really need to make sure I'm getting good sleep because I'm about to be interrupted. It doesn't work that way. It somewhat works the other direction, that if you haven't been getting good quality sleep, you can make up for it, but it's not always going to work so clean cut. I only got 4 hours this night. I'm going to get 12 hours the next night to average out to 8 hours. It doesn't really work like that. So really trying to follow what your body is feeling in terms of what I need to get by, what I need to feel rested, because as we saw also, too much sleep can cause problems in the other directions. Something like Kathleen mentioned is making sure your bedroom is comfortable, lights, temperature. Animals, I hear very often in the work that I do with individuals, is that can be very disruptive. Our pets wake us up at night to sometimes have to use the restroom, or they're not comfortable. And we want to really eliminate as many distractions as possible from the bedroom. So that also means having a comfortable environment as well. And so then we also want to eliminate the amount of exercise or intense physical activity we're doing closer to bedtime. This is the idea that, we're really working up our body and our different systems to then be switching them off for bedtime. That's not really going to work. So we want to give ourselves a good amount of window in there. Same thing with eating, except it's maybe something counterintuitive, but actually having a light snack at bedtime, eating something right before bed can actually be pretty helpful to promoting, sleep processes. But we don't want to eat anything too filling, too heavy, and we don't want to eat in the middle of the night. But something light, a glass of milk or a small, not too filling item can actually help us stay asleep longer. The idea of that is that we're not having our stomachs wake us up in the middle of the night and those types of things. Using the restroom is also a very common sleep disturbance issue. People have to use the restroom very frequently. And what we find is that, eliminating liquids, this is just a good rule of thumb for all, several hours before bedtime can really help with those nighttime awakenings. If we're not waking up for a certain reason, then we're not going to have the difficulty in getting back to sleep. But if we have reason to wake up, that might promote more trouble later on in actually getting back to sleep. So avoiding excess liquids a few hours before bed is important. And then, the two last rules of thumb or healthy tips are to stop caffeine. This may be longer than we're used to, of 6 hours before bedtime. Some people might enjoy a soda with dinner or coffee with dinner, and these are things that we maybe want to avoid. We hear often, I'm tolerant of caffeine. It doesn't affect me in the same way. And it likely won't affect you in your ability to fall asleep. But like Kylie was explaining earlier, it's going to affect those stages of sleep so that you might not ever reach that deep REM sleep that's restorative for the brain if we're using caffeine too close to bedtime. And the same thing with alcohol and nicotine. Nicotine is a stimulant, and so that's going to actually keep us from getting to the stages that we want to. And alcohol, although, some people do use it to help them feel sleepy, and it is effective at that, it's going to lead to more fragmented sleep because it actually moves us through the stages too quickly. And you're not going to get to that really deep restorative sleep just due to the way that it metabolizes in the body. So there's a lot of connection to the body and to sleep. And so what I'd also like to talk about is how the brain connects to sleep. And these start to kind of bleed into the rules that are actually very important to follow. So this is no longer brushing your teeth and flossing. This is going to a dentist and getting cavities filled and these types of things. These are things that we need to do in order to make sure that sleep is not impacted. If you're not doing some of these things and your sleep is okay, that's fine. But this is where we start to see if there's a problem, it may be because something, one of these rules is not being followed. So I like to always preface this in connecting the mind and sleep in drawing some other connections to other things. So when you see popcorn here, I'd like to know what the group thinks of when they see popcorn or they think of popcorn. What are some things that come to mind? In the chat or by voice is fine as well. So we've got movies, a couple of movies, lots of movies. Sharing, that's always sweet, Kathleen. Snack, I wonder if anybody thought of butter or salt, anything that kind of really connects us with popcorn, but movies is the really typical thing. And so this is where, you know, we can really draw some connections to when you walk into a movie theater, popcorn and that smell of popcorn, it all really becomes very synonymous with each other. So that when you smell popcorn, you might think of a movie. When you have a movie, you might start craving popcorn. This is the same type of brain connection that we would like to have with sleep. So my next question is, when you get into the bed, what are some things that you're doing that aren't sleep? I don't want to, you know, call anyone out, but if anyone feels comfortable sharing what they're doing in the bed that isn't sleep, just so we can draw some more connections here. So I think I saw somebody earlier say Netflix. That's a good example of something we might be doing in the bed that isn't sleep. Reading on our phones. Yeah, so I'm really guilty of that as well, of checking emails for the last time for the day, watching some TV or reading. These are all things that we start to notice, or we might be doing in the bed, that are actually pairing the bed in our mind with these other actions that aren't sleep. So watching TV, conversations with your partner, reading. And what we'd really like to do is flip the script, as this says, to be able to think of the bed and connect it with sleep, just like we did with that popcorn and the movies. We want to draw that connection so closely that as soon as you see the bed, as soon as you lay in the bed, we're really able to go to sleep and go to sleep easily. So these are the rules that we talk about in sleep for following. And the first one would be using that bed only for sleep and intercourse. And again, that's in order to connect the bed and even the bedroom with a cue for being asleep. So, you know, as soon as you get in the bed, your sort of mind is already thinking about being asleep. That's going to be the strongest connection we can make. The sleep rule number 2 is doing something to unwind and to transition your mind, such as listening to music or a relaxing bath. There's a lot of things that we do for children, you know, such as routines, which we'll talk a little bit more about later, but also this unwind time, such as story time, bath time, quiet time, or nursery songs or rhymes that are ideal to transitioning the mind for a child of being wide awake and wired to being able to go to sleep. This doesn't change as we get older. This, in fact, you know, is something that we don't think about as much, but is still equally important, is being able to make transitions away from the wakefulness of the day into the nighttime. And so having a scheduled wind down time can be actually make a world of a difference in being able to get good quality sleep. Also, maintaining a consistent sleep schedule. This is another area of challenge for a lot of people, especially when we're working. And on the weekends, we'd like to sleep in, or, you know, like we talked about earlier, you don't get a good night's sleep, so the next night you sleep even longer. What we're doing is we're actually creating a bit of a whiplash or even jet lag in our sleep schedule. And that's going to throw off that circadian rhythm that we talked about that is so important for sleep. If you wake up at one morning at 7 a.m. and the next morning you're up at 10 or 11, you've essentially traveled across the country and created a jet lag in yourself that your body starts to kind of wonder, what time should I be going to sleep? What time should I be waking up? And so that's where it's really important to have a consistent schedule. Sleep number 4, rule number 4 is not going to bed until sleepy. This is another area of challenge for a lot of people, especially when we're dealing with physical fatigue, exhaustion, even pain, chronic pain difficulty. Is we're not necessarily sleepy, but we're tired, or we're physically tired. And so we use the bed as a place of relaxation. And what we really want to do, again, to draw that connection, is only use the bed for a place of sleep. So when you're sleepy, eyes are drooping, head are nodding, that's when you want to actually go into the bed. If you're tired, you should still relax and you should still rest, but we don't want to do that in the bed. So that might mean finding a comfy place in the living room, or, you know, really relaxing in a chair outside of the room. Again, trying to help that connection between the bed and sleep. Avoiding naps, this can be a challenge, but we don't want to nap unless it's absolutely necessary. And if it's necessary, limiting it in time and also the time that we do it during the day, because it can start to take away from that nighttime sleep. Throughout the day, we're building up a balloon. I like to kind of use this analogy of all the energy that we're spending and expending throughout the day is getting to fill up this balloon. And throughout the night, that balloon is what carries us to sleep throughout the evening. If we nap, then we're technically letting air out of the balloon earlier in the day, and that's not going to give us the same quality or duration of sleep that we would have had if we hadn't napped. And then lastly, it's using the 15-minute rule. So this means if you're unable to sleep after 15 minutes, whether that's when you're falling asleep initially or if you wake up in the middle of the night, we want to actually get out of the bed if you're unable to sleep within 15 minutes. And I do want to warn you, we don't want to necessarily be staring at the clock and counting down 15 minutes. But if you feel like, man, it's been a little bit of time, I'm still not able to go to sleep, I'm going to get out of the bed and do something relaxing, which I have some examples here on the right-hand side, to sort of help my mind kind of transition back into sleepy mode. But I'm not going to use the bed as a place to do that, because as we talked about, we want to make the bed only a place for sleeping. And if we lay in bed awake, we start to maybe associate the bed with a place of being worried about our sleep, lying in bed awake. It starts to kind of misconnect those things that we want to do with sleep. And so a big, huge part of sleep, like Kylie mentioned earlier, especially in caregiving, is the amount of impact that stress has on sleep. And so in addition to a lot of these rules, if stress, if anxiety or worry are causing a lot of sleep difficulty, we want to really target that stress in order to help improve the sleep. We can do all those other rules, but if we're not dealing with some of the worried thoughts or the stressful thoughts, then we're not really going to be able to improve sleep. And so scheduling relaxation is a huge part of the treatment that I do in terms of insomnia with people, is making ways of relaxing yourself, both body and mind, before sleep to really make sure we have good quality of sleep. And this may mean changing your thinking around sleep and worry. A lot of people have sleep difficulty because they're worried about sleep. You start to really focus on, I'll never sleep again, I'll never get good quality sleep. Man, it's been hours and I still am not able to fall asleep. And that actually falls into that cycle that Kylie was explaining, that will actually make sleep worse the more that we worry about it. And some things to think about, in terms of other worries or worries about sleep is integrating some types of relaxation strategies to help reduce the anxiety level. And that might mean deep breathing exercises, progressive muscle relaxations, which, if you're not familiar with that, is a physical exercise where you are tensing and relaxing muscle by muscle of your body. That's really effective at reducing stress. Guided imagery, which just takes us through a relaxation meditation to kind of thinking about some place that is relaxing for us. I've put a couple of apps that are really great at some of these strategies that I'm talking about, especially with breathing. There's one that it will show you the time that you're breathing in and then show you the time that you're breathing out. These are all things that would be great to incorporate in a bedtime routine, again, out of the bed, but at some point before you're going to sleep, to help you really relax. Another thing that I do a lot with individuals is a scheduled worry time. So what this means is if we're waking up in the middle of the night because there's a certain problem that just keeps coming back to us, or we're thinking about a long list of things that we have to do. And as caregivers, I know that that's a tremendous amount of stress of making all these different decisions, and it's a frequent challenge. It can sometimes be helpful to try a scheduled worry time where you give yourself between 2:30 and 3 each day to really kind of hash out all of your worries or make that to-do list. And we're moving that worry time from nighttime to an actual designated time so that it isn't going to interrupt us while we're trying to sleep. Something that I wanted to touch on, because we're talking about caregivers and sleep, but as we've mentioned before, how dementia can sometimes change sleep patterns is impactful, not only to the caregiver, but to the person living with the diagnosis as well. We can see some different things happen, such as day-night reversals, where people may sleep more during the day and have more frequent nighttime awakenings. There can be decreases in slow wave sleep. So those are some of those stages that we're talking about, and rapid eye movement sleep. And there can even be acting out certain movements in sleep that happen with certain types of dementia and REM behavior disorder. You might hear that kind of thrown around from a provider if that's a diagnosis that your loved one has. All of these things mean that there are changes in sleep. And as Kylie mentioned, that's happening because the neuron pathways might be being impacted by the diagnosis. And so the same messages, the same sort of neurons that are firing in our regular sleep are starting to change. And so that means there's going to be changes in sleep. This can mean more fatigue and burnout for the caregiver, but it can also mean an impact of symptoms in the person living with the diagnosis as well, such as their cognition and their ability to cognitively function in the same way. And so for tips for improving sleep for somebody living with a diagnosis are a lot of the same things that we've talked about for, every other person as well who's dealing with sleep, is to follow a lot of the healthy sleep habits. Something that I do emphasize a lot is the liquids tend to be an issue as well. As we know, toileting can be a bit of a difficulty, or having that awareness of when is appropriate and when not. And there might be some more frequent nighttime awakenings to use the restroom liquids, and reducing the liquids can be helpful in minimizing that. And so really emphasizing a drinking of liquids earlier in the day and less at night to try and help with that. But also a lot of the other tips that we talked about, getting exercise, getting sunlight, as we talked about in the video that Kylie showed. The chemicals get released by exposure to sunlight. And so sometimes that might mean just sitting outside for a little while during the day and then turning off the lights in the evening can help that day-night switch that happens sometimes, as well as nap times and routines. These are all things that are very important, especially in living with dementia. Having some type of structure and routine, wind down times, a sleep-wake schedule, trying to keep some structure is really going to help facilitate a more healthy sleep pattern. But there are some challenges, as we talked about with certain types of dementia, some sleep disorders, or even medications that can impact sleep. And so if it is becoming a significant problem, it may be helpful to talk to your doctor about what's going on. And although we want to eliminate as much as possible sleep difficulties at night, if there are still going to be sleep difficulties, we definitely want to create a safe environment in the middle of the night so that there isn't further awakening by any type of fall or any issue. We want to help as best as possible by creating, a safe space with grab bars, night lights, clearing the floor, whatever's necessary to keep everyone safe. So then I wanted to talk briefly, because we all do struggle with sleep at times. And as we talked about, certain life events or changes are going to impact sleep. That's just the reality of it. There are things we can do to try and help in those situations. But there is a certain line or a certain point where the sleep difficulties are no longer as a result of what's happening or the certain situation, but they've become what we might call more chronic. And so we want to maybe seek additional help when things are becoming more difficult or not fixed by the things that we've talked about before with the sleep habits and tips. And so this is where, again, it's really important for you, how you're feeling about your sleep. If you feel like it's been a problem for some time and you're not really able to get quality sleep, that's very different than, oh, I just had a bad night last night and I feel better today. It's, again, how you're feeling. Some common things that might be happening that you would need a formal evaluation is something like an insomnia difficulty, where you're having trouble falling asleep or staying asleep. And that's typically quantified by having that more than 3 weeks with no stressor there. So, if you have a reason to be waking up, that makes sense. But if there's no reason to wake up and you're still having those middle of the night awakenings or trouble falling asleep, that's where it starts to lead into some insomnia. Sleep apnea is always something really important to mention with sleep. We're hearing about it so much these days, and there's a lot of great treatments, but it's also being talked about more because we're being more able to diagnose it. And so that's why we hear a lot about sleep apnea, but that's basically a disorder where your breathing will start and stop throughout the night. And so some things, the risk factors include the following that I mentioned there. This is important to treat because it can have impact on cognitive functioning and cardiovascular functioning. And there's some great treatments out there to help mitigate the impact of it. And so we really, encourage that if you're having, you sleep 8 hours and you wake up and you're still feeling really tired, or if anybody has ever said, I see you stop breathing in the middle of the night, or any of these types of things, this would be something important to check out for yourself. That requires a formal evaluation, but in all diagnoses, it's not always required to do necessarily a sleep study or to wear some type of device. This can sometimes just be managed by talking to a doctor about what you're experiencing and what things you're feeling. But there are a lot of treatments for these different sleep difficulties. So the treatments that I practice in therapy with people is sort of the gold standard, or the first try that we want to make is trying some different therapy techniques in dealing with insomnia. But there are medications as well. They're not recommended for long term, but they are very effective in helping people get back on track with sleep difficulty. And then, as we talked about with sleep apnea, there's a lot of great options out there right now, devices, even surgeries that are minimally invasive, but a lot of great devices that people are using at night to help them get good quality of sleep. Something I didn't put on here is something mentioned earlier by Kylie, is depression can cause really a lot of impact to sleep, whether that's less sleep or more sleep. And so if that's an area of difficulty, if you're finding yourself having other symptoms of depression as well, these tips and strategies can be helpful. It's always helpful to treat sleep, because as we saw with that cycle, sleep can make depression worse or anxiety worse. And so if we can improve sleep with some of these tips, it can help in those other areas, but it may be important to get treatment for the other symptoms as well, such as therapy, potentially medication, these types of things as well. So those are all of my slides. I wanted to acknowledge that a lot of this training, a lot of this information came from the training that I received in terms of actually working with insomnia, to the manual that we use. But I thought that they were really helpful tips to share with you all as well. But so I'll stop sharing my screen here, and I'm guessing that this is now time for us to do a bit of question and answer as well.
Yes, that would be great. Thank you all so much. I'm going to stop the recording so everybody can feel comfortable asking their questions. Thank you both for that wonderful presentation. So I'm going to